This is our Universal Composite Tray. The instruments can be used for composite or an amalgam. Some doctors might not use all of these instruments, but we have them here so we can learn them. This is our high-speed handpiece. It is a push button handpiece. It attaches to the unit by these ends. There's two holes, a bigger one, a smaller one, and two little holes there. This just goes into those, and this finger tights right around it. This is the handpiece that our doctor uses to remove the decay for the cavity preparations. This is our burr block where we keep our burrs safe so they don't fall on the ground. This burr right here is a 557. We're going to put this into our push button handpiece. We're going to hold it right here. We're going to push this in real hard, and we're going to place this inside. You always want to tug a little bit on that and make sure it's inside of the handpiece. Also an air water syringe. Make sure you're not going to use this end. It's always the end that has little hooks on it. Air water syringe tip, air water syringe. Two rings. The outer ring is pushed back. This is placed in and a small little tug. On our tray itself, we have our anesthetic syringe. Depending on the tooth you're doing, if you're doing a maxillary tooth, you would use the blue needle for infiltration. If you were doing a mandibular filling, you would use the yellow needle for the block. We have a bite block to keep the mouth open if the patient's having trouble. Our cotton tip applicator for our topical, and we'll go into our instruments. This is our mouth mirror, so we can see inside the mouth, our indirect light and retraction. We have our cotton pliers to pick up things, hand them to the doctor, make sure they can get them, and to reach into our drawers if we can't take our gloves off at that time. We have our explorer and our periodontal probe. Check the teeth, make sure they're free of cavities or have cavities, and the doctor can probe the area, make sure the pockets are good. The doctor would check everything out, make sure everything's going well. We would get the patient numb. We would load our anesthetic syringe. The rubber end goes in onto the little harpoon. Pull this back, place that in. We're going to say we would do number 3. So we're going to use a blue needle. We're going to put this into there and gently just turn. And then you harpoon it. You make sure that everything is ready. The anesthetic unit is now ready for the doctor. Our doctor, we place our topical for them and then hand them the anesthetic. Once the patient is numb, we would give our doctor a mirror and explorer. They would check the patient, and then the doctor would do his cavity preparation with his high-speed handpiece. Water comes out of these two little holes, and he would use his 557, or he would use 330, which is a little bit smaller. And if he has to, he would change his handpiece and go to a slow speed handpiece with a contra angle. It has the contra angle and a slow motor. Same hookup on the bottom. And these have a latch. The little latch opens, closes. We have a latch burr. It's a little round burr it has a little hook on the back. We place it into the front. You can look into the back and watch the burr come in. Once it goes into the back, you know you can close it, and now it's locked in. The doctor can remove soft decay and dentin with this contra angle. He would remove it. We would be blowing air to keep the tooth cool. After the cavity preparation is done, the doctor would place, depending on the surface, let's say it's an mesial, occlusal, we would need to place a matrix band. The matrix bands in the Toffelmeyer, they replace the walls that are missing on that tooth. Then we could use a spoon excavator. It has different sides to it. It scoops out soft dentin and decay of the tooth, so the doctor's not going to get too close with his handpiece. After that is all, the tooth is all cleaned out, rinsed and dried with your HVE and your water, the doctor would then etch the tooth. Some doctors may use the etch on a molar and some may not. The etcher would be left on the tooth for about 20 seconds. What the etchant does is sulfuric acid. It removes the smear layer, makes the tooth white and chalky so that our adhesive will stick better to the tooth. So we rinse that off and then we place our adhesive. There's many different kinds of adhesives. You would just take a little drop of this one, put it in our little mixing well, take it, scoop it, and then it would go inside of the tooth and then it would be light cured. This will harden the material and make it ready for our flowable material or our packable material that goes into this little gun. That's just a little bit of a harder material for the doctor. If we use this packable material, we're going to use our plastic instrument. Plastic instrument will scoop, transfer material, and smooth material. Once that's all done, we also will light cure the material, the composite material. Then it's done in layers, so we could be adding it. The last layer could be done and used with the discoid cleoid carver. It is a carver. It is used for anatomy, carving anatomy into either amalgam or composite material. The same with the football burnisher. The burnisher can make things smooth. And it's also used for making the matrix band. You can take it and you can burnish the matrix band to make it fit between the teeth a little bit better. Multi-purpose tools. Then after everything is done, we will light cure, remove our matrix band. Final step would be to check our bite with our articulating paper. We tell the patient to tap, tap, tap. Adjust any bite. We would take our slow speed back off. Place back on our high speed for the doctor. We would remove the 557 and place on our football. Our football burr does adjusting to the fillings and makes it feel more comfortable for the patient. That is how we do our fillings.